Hi, my name is Abby, and I'm going to present the first activity of this multicultural part. So here is the simple linear regression I've obtained from the information given. So from the problem description, first the research question I thought was interesting to look for. It was, how does age affect the number of stomach cancer deaths in Mexico? So the context of this was that stomach cancer is an important cause of cancer mortality worldwide. So what I thought to explore was that where here age is a known risk factor and a key demographic characteristic that commonly correlates with a higher incidence and mortality. So for the public health planning in Mexico, I thought interesting understanding whether the number of recorded stomach cancer death grows in a linear way with age group, that this will help us to guide several prevention programs for people in certain ages in order to prevent these stomach cancers. So the variable of interest I thought to explore was first the number as the dependent variable. Now the age myth that relates with the midpoint of the age group, which converts the dataset age group label into the middle of the both labels that are given. Also, I am exploring the variable of the year and of the gender. So now for the data collection and preparation, the data I used was the human mortality dataset for stomach cancer given in this activity. So I use Google Colabs for developing the code in order to obtain the graphs and the information that will allow me to interpret the results in my research question. So first I converted the death count column of the numbers in order into numeric numbers and dropped rows without the numeric counts. So second, with the converted year to numeric and selected the latest year with Billy data. Third, I normalized the age group labels and converted them into a numeric midpoint, which I explained before. And lastly, I added the death counts by age mid to the chosen year to produce one observation per each age. So the data exploration I obtained was the count of age group observations was 19 age groups. So then the mean number of deaths across each reported age group is approximately 651. The standard deviation is approximately 617. The median is 538. There you have the minimum, which was 0, and the maximum that was 1,558 deaths, and also the variance, which is shown here. So we can see it's a huge number of mean and median in the max compared to the maximum of the deaths value. So what I obtained was these two graphs. So in the first one, I would say that death counts are very low in the youngest age groups from 4 to 14 years approximately. This mortality increases substantially from the middle to the onward part that is around 30 years. Here the counts reach a peak in some of the older groups of age, as you can see here, which has a slight decline at the final part in the intervals of approximately 82 years to 85. And in the second one, result of the linear model, here I capture I think a strong upward trend with age overall, but the residuals revealed a systematic deviation where the slope I think underestimates the early midlife that increases and also overestimates at some older ages, as you can see here, indicating a non-linearity um, in the real age pattern that we obtain above here. So with this, I got the interpretation that complements what I said before. First interpretation, which we got a linear slope of 20.47. Here, the linear fits predicts approximately 20 additional deaths for each 1 year that increase in the age midpoint, which I obtained, holding the model assumption I had that yes, the deaths increase towards age passes, and the coefficient of determination it was explains about approximately the 84% of the variance across the aggregated age groups for the chosen year, so it is a high coefficient. So then, as a conclusion, I could grout here that the analysis shows that as people in Mexico get older, the number of stomach cancer deaths increases significantly. The linear regression here confirms that a strong positive relationship between age and mortality, with older adults is being the most affected group. This pattern, as it said there, highlights how age is a major factor in stomach cancer deaths, suggesting that prevention and screening programs should focus more on middle age. This was, as I said before, that it should be several help programs for preventing this disease. So it should be concentrated in middle-aged people and elderly population as similar. So, and although the relationship appears mostly linear, the data resulted suggesting that the increase in deaths accelerates around the middle age and stabilizes around the oldest groups. So we got that conclusion for the graphs and as an answer to my research question. And as limitations, I would say that this study only focuses um, on using the total deaths counts by age group and does not consider how many people belong to each age group, which could like make different comparisons between ages and not make like an specific comparison. It also doesn't account for many factors like the social factors, as I wrote here, like the lifestyle of the or the access to healthcare related to the economical factors of each population. And I think this might affect also these analysis of the data. And finally, using the data from a single year limits the ability to understand the long-term trends, as I said. So the future studies should, I would say, to include rates, multiple years, and more variables in order to complete like a complete picture of this analysis. So yeah, I would say that about my investigation and interesting facts that was discovered here and interesting conclusions to obtain in order to focus more on a prevention program to this disease.